Introduce the amazing speakers that we have this afternoon. And today we have assessing knowledge and attitudes of long-term care residents regarding antibiotics and vaccines before and after pharmacy students-led interventions. And the speakers that we have are Milli Talagtag, Lizette Tavares, and Paku Vang, who are all pharmacy candidates.
Yes.
Awesome. Join me in welcoming them to the stage.
Thank you. Good afternoon, everyone. We are third-year pharmacy students of the Gregory School of Pharmacy, and today we'd like to present to you our research project. The title of our research, like he mentioned, is Assessing Knowledge and Attitudes of Long-Term Care Residents Regarding Antibiotics and Vaccines Before and After Pharmacy Student-Led Interventions. So before we get started, let's go over a brief background of our research. So about 2 million people experience antibiotic resistance annually in the U.S. Every year, 23,000 people die as a direct result of infectious disease. This is associated with the increased risk of elderly patients in long-term care facilities, and the mean age is over 80 years old, and they have a risk of infection of 32.7%. According to the CDC in 2015, 1/3 of patients over the age of 65 did not report having any other pneumonia shots, including the PPSV23 or the PCV13. 2/3 of patients did not report having their shingles shot. Patient education on antibiotic and vaccine therapy is important in the elderly because, one, polypharmacy, which leads to lack of compliance, and two, insufficient knowledge of appropriate antibiotic use and vaccine, therefore inappropriate use of antibiotic therapy. Now let's go over our primary objective. It is to assess and evaluate the impact of pharmacy, student-led interventions on geriatric residents' current knowledge of antibiotic and vaccine use. And the primary outcome is a score increase from baseline as measured by a post-assessment score of greater than equal to 70% with a greater than equal to 10% increase. And on to methods.
All right, so now I'll be going over the methods that we used for our study. So to start off our study, we first administered a 10-item questionnaire to all residents, and that was just to assess any baseline knowledge that they had prior to our intervention. Following the administration of that questionnaire, we just gave them about 10 to 15 minutes to fill out the questions, and then we gave a 15-minute poster presentation. And following the poster presentation, we also administered the same 10-item questionnaire, and that was to assess any knowledge gained from our presentation. Following that, we administered a 5-item survey just to assess satisfaction with our program. And then our data was analyzed using the statistical software IBM SPSS version 24. So this is just to highlight a few of the topics that the poster presentation we presented at the long-term care facilities covered. We gave a definition of what antibiotics are as well as appropriate antibiotic use. And we also provided education on proper hand hygiene. And then the different topics that we covered in the poster presentation included several common illnesses such as influenza, MRSA, and UTIs and the other infections as listed on the screen there. And it was a discussion of the transmission, prevention, and the role of antibiotics and vaccine use. So this is just a screenshot of the 10-item questionnaires that we administered. As previously stated, the questions are the same before and after the intervention, and they were just 10 true and false questions on the various common illnesses about appropriate antibiotic use and vaccine use. And then again, the same questions administered following the 15-minute presentation. And lastly, on your far right-hand side here was the 5-item survey. It was a rank survey with a scale of 1 to 5, 1 being strongly disagree and 5 being strongly agree. And that was just to assess how satisfied the residents were, with our program.
Okay, so for now, we're going to be talking about our results from our experiment. So we enrolled about 41 subjects, but we used per protocol, meaning that we want to only analyze completers. So out of the 41, we have, wrong button, sorry. Out of the 41, we have 31 completers, and that's per protocol analysis. Overall, the resident score improved at about 20% mean score improvement with a baseline score of 67.7%. That means that means it is 21 out of the 31 per protocol analysis. For satisfaction, we have a value of 20 because the max is 25 for our satisfaction survey. So the value of 20 is what we consider satisfaction. And the mean score improvement on our test using a one-sample t-test, we have a 20.97 satisfaction. To see if we want to do a non-parametric or parametric study, we use the Shapiro-Wilk normality test, this one right here. And because the data was not normally distributed, we use a non-parametric test, which is the Wilcoxon sign rank, and that there was a significance between our pre-assessment and post-assessment scores with a p-value of less than 0.001. So this, as Paku showed, is just a bigger picture. This is our pre-assessment questionnaire, and this is the pre-assessment questionnaire, so that's before our intervention. So as you can see, the mean score is approximately 7.13. And then this is like a bigger screenshot of our post-assessment questionnaire. It's the same questionnaire as the pre-assessment, and there is an improvement. We have a mean score of 8.90. So that's from 7.13 to an 8.90 after the intervention that we have, which is we taught them about different things about vaccinations and antibiotic therapy. The next slide will be our satisfaction survey, and again, a bigger screenshot of our satisfaction survey. Again, satisfaction was considered to be 20. The mean score that we got, as you can see, is curving more to your right side, is 20.97. So as to this is our discussion section. So majority of the residents that we did have, which is the 31 that which we analyzed out of the 41, did show a mean score improvement of 20% in the overall score, with a baseline improvement of 67.7, which is 21 out of the 31. And satisfaction is achieved with a greater than 20% score, and we had a 20.97 score. We do have limitations in our data. For example, we only had 31 residents that we could analyze, so our sample size is small. We also used the per protocol analysis because of the small sample size. And additionally, our residents have varying mental statuses, so it could have affected our data. This too, which is the Stamp Out and OTC program, these are different programs that use student-led intervention. And for example, for the Stamp Out, what they did is they taught patients about drug misuse and abuse. Before they did their intervention, which is similar to ours, they noticed that long-term care residents only had 36% that they know about their drug misuse and abuse. And after they did their intervention, they had 100% of the seniors who actually scored 100% in their quiz. And the OTC program is another program that was led by pharmacy students. And this one, about when they did their intervention, they talked about OTC that the patients are taking, and they found out that most participants, based on what the students said, would change their regimen, and a lot of them, which is 91.8% of participants, would want programs such as these to be more implemented in different long-term care facilities. So we do want to conclude that from the results of our study, we want to emphasize the importance of having pharmacy student-led interventions in teaching a lot of our patients about the benefit of antibiotic and vaccine use, and other programs with different topics that show that this is a very important part of, as a pharmacy student, to increase the knowledge of your population. We want to give a special shout out, a special thanks to our GSOP advisors, which is Dr. Alia Shaheen and Dr. Jamie Fairclough. And this is our references. And this, the one in the background, that is the actual poster that we use to educate our residents in the long-term care facilities. And we thank everyone for your time. And if you have any questions, feel free to ask.
I have a quick question.
Sure.
For your satisfaction survey, you may have gone over it already. What were you trying to obtain? What information were you trying to obtain?
Let me also go. So you can see. Okay, so we're trying to obtain if the information that we presented was something that they feel is important, like that they're learning from our information, and having pharmacy students go to a long-term care facility, is it beneficial for them? Were they learning something in terms of what we presented? So we have like this one, like for example, like the information presented is important for me to know. So if they put one that if they feel like there's not really a benefit for it, it's not really important for them to know. And then it ranges to I recommend this topic to people in my age group, because we're focusing a lot more for our our elderly population, because they have high risk, especially if you're in a long-term care facility, you have a high risk of infection. And we have this with vaccines, we have like different information coming from different sites that might not be correct. So we want to tell them the correct information about vaccine therapy, especially with a population that are at high risk.
And did a lot of students agree with you in terms of, oh, sure, it's useful for me to know, or were there a lot of students who disagree with that? Or
I mean, there are some that, of course, there's always going to be variation, but I think a lot of them I believe we did notice that a lot of them have, they have that fear that if I give you a vaccine, I'm going to have, like, for example, the flu vaccine. Like, if I get the flu vaccine, I'm going to get the flu. So a lot of them is at having an open talk of knowing, like, what do you really think? And this is, like, what the data that we have. And a lot of them are very open. You're always going to have, people or, like, long-term care residents that have their own opinion. But I feel like giving them the information is very beneficial, because it lets them decide what is good for their health.
In your satisfaction survey, like, which questions did you find were mostly 5s, and which questions did you find were like was mostly like closer to a 1?
Okay. I think number 2. It's harder because we have like HIPAA rules. When we went to a long-term care facility, which is this question is more. Oh, sorry, I haven't like had this button ever, so I'm going. Okay, is this? Okay, so question 2, which is the poster, helped me to better understand the topic. We did get some of the residents stating that we need probably a bigger poster, because they're a bit older, so sometimes the poster might not be the best in terms of the size for them. So maybe when we do it again, maybe have like actually printouts for them, so it's easier for them to see. I think that's the one that I've noticed when we're doing the analysis, that we tend to lean more into a lower grading. But in terms of wanting to have this, we tend to have the higher grading, whether in the recommendation, which is 4 and 5, we tend to get like a higher rating for those. I think it's just the presentation of the posters for them visually. It was a little bit difficult with some of the residents.
Okay.
Hi.
So, these were individuals in a long-term care facility?
Yes, sir.
Okay, not an assisted living, just general long-term care?
Yeah.
Were they ambulatory, or was it a mix?
We had 2.
Mostly ambulatory.
Yeah, they're mostly ambulatory. I think that's what one of our limitation was, that it is harder to because we can't really get their medication history. Medical history. So there is some limitation for that, because we don't really know how much they understand the information in a way. So there's that limitation. But most of them, the 2 residency that we did go to, a lot of them are ambulatory, because most of when we talk to the people who does the events, they did tend to pick like the residents that are more like ambulatory. They're not like bedridden or anything like that.
When you guys designed the study, and part of it, I understand that, you had a limitation in terms of accessible population. Do you discuss, probably with Dr. Fairclough, you might have had a discussion over this about like pretest sensitization, and, you didn't have kind of like a control group that you just tested twice without the intervention. Did you talk about that at all, or you were kind of limited because you only had like 31.
Yeah, I think our problem was like the amount of the patients that we have was limited, so it's really hard to have like a control group, because even just having like I guess we can say our treatment group is already limited, so it's hard to have the actual control group in our population.
Are you guys going to try and get it published, or?
We presented it because of the limited number. we're gonna try, but we did present it in the ASCP, which is consultant pharmacy, that does deal a lot more with our our geriatrics population.
Well, thank you.
You're very welcome. Do you guys have any other questions?
Thank you.
Thank you.